Yeah, actually, perhaps about half of, between 50 and 70% of patients who have the carcinoid syndrome will develop carcinoid heart disease.
But not just patients that have a carcinoid tumor.
So patients with neuroendocrine tumors, about 20% of them will develop carcinoid heart disease. In other words, you first have to have a carcinoid syndrome. That means you have a functional carcinoid. The definition of functional is that it's a carcinoid which is secreting substances which cause symptoms. So that's an excellent question. 50 to 70% of patients with carcinoid syndrome will at some point in their disease develop these changes which we call carcinoid heart disease. Yes, so one of the teaching things that we're trying to accomplish is to educate doctors to first look with a baseline echocardiogram at any neuroendocrine tumor patient, not just for carcinoid heart disease, but other diseases of the heart can exist along with the neuroendocrine tumor. So if they do an early baseline echocardiogram, and if there are very early signs on the echo of carcinoid heart disease, they can immediately focus on reducing serotonin and protecting the heart. So the short answer is probably not, because serotonin usually causes diarrhea and often flushing. And so if you have a tumor which is not secreting a high concentration of serotonin into the blood, you probably will not develop carcinoid heart disease. It would be very unusual.